Sleeping pills. Which prescription drug is right for you? Hello, I am Dr. Naras Bhat, and my research student Nipun Bhandari will present rest of this research.
So let's look at an overview of today's presentation. Prescription sleeping pills are classified according to sleep architecture and the impact they have on disrupting sleep architecture. We'll compare benzodiazepines to Z-drugs. Sleeping pills are also classified according to their effect on sleep duration. We'll look at sleep onset insomnia and the difference between that and sleep maintenance insomnia. So first, let's talk about benzodiazepines. Benzodiazepines are the class of old drugs used to treat insomnia and anxiety. They act on all three GABA alpha receptors in the brain and tranquilize the mind, relax the muscles, induce or maintain sleep. But they disrupt sleep architecture, thereby suppressing REM sleep. Benzodiazepines such as Restoril, Halcyon, and Prosum are also habit-forming. Let's look now at Z-drugs. Z-drugs are the new type of prescription drugs used to treat insomnia, named so because their chemical names have the letter Z. Z-drugs act only on the sleep-promoting receptors, the alpha-1 component of the GABA receptor. They do not affect sleep architecture, and they are not habit-forming. So let's take a look at all the prescription drugs we'll be talking about today. Here are the medications we will discuss in this presentation: Sonata, Lunesta, Ambien, Trazodone, and Silanor. So first, let's look at Sonata. Sonata, or Zaleplon, is a short-acting prescription drug for insomnia. It is used to treat sleep-onset insomnia. The usual dosage is 10 milligrams in adult patients. Side effects include drowsiness, nausea, and abnormal dreams. Let's look now at Lunesta. Lunesta, or esoplaclone, is a common sleep medication used to treat both sleep-onset insomnia and sleep maintenance insomnia. The usual dose is 2 to 3 milligrams for adult patients. Side effects of Lunesta include headaches, cold-like symptoms, dry mouth, and drowsiness. So let's look now at Ambien. Ambien, or Zolpidem, is another common prescription Z-drug. Ambien is short-acting and thus treats sleep-onset insomnia. Ambien CR, however, has a second layer of Zolpidem and acts over longer duration, treating both sleep-onset and sleep maintenance insomnia, allowing you to both fall asleep and stay asleep. The side effects include nausea, hallucinations, and short-term amnesia. Let's now look at depression-based insomnia. Several patients with depression also suffer from insomnia. Your sleep problems may be related to depression. There are 2 simple questions to elicit your depression. First, do you feel down, sad, or hopeless? And over the last 2 weeks, have you felt little interest or pleasure in doing things you usually enjoy? If the answer to both questions is yes, you may have clinical depression. One of the antidepressants we will look at today is Trazodone. Oftentimes, patients with both depression and sleep-onset insomnia are prescribed Trazodone. Trazodone is an antidepressant, but also has hypnotic effects. A dose of 25 to 50 milligrams can calm depression-induced insomnia in patients. Side effects include drowsiness, nausea, and dry mouth. Another antidepressant drug is Silanor. Silanor, or Doxepin, is an antidepressant that was recently approved by the FDA for the treatment of sleep maintenance insomnia. The antidepressant dose is 50 to 100 milligrams, while the hypnotic dose is 3 to 6 milligrams. Side effects include drowsiness, nausea, and headache. So let's summarize the drugs we've talked about today. We've learned about benzodiazepines, Z-drugs, and antidepressants, all used to treat insomnia. Under benzodiazepines, we briefly mentioned Halcyon, a drug used to combat sleep-onset insomnia, Prosum, and Restoril, both drugs used to treat sleep maintenance insomnia. Under the classification of Z-drugs, we've talked about Ambien CR, or Edular, which is used to treat sleep-onset and sleep maintenance insomnia. We've also looked at Lunesta, used to treat both sleep-onset and sleep maintenance insomnia. And we've talked about Sonata, a prescription sleeping pill used to treat sleep-onset insomnia. We've also talked about antidepressants that can be used to treat insomnia as well, like trazodone, used for sleep onset insomnia, and Silanor, used for sleep maintenance insomnia. Follow Doctor of Insomnia online at twitter.com for more information and research from the Concord Sleep Clinic in California.